Primary open angle glaucoma. So primary open angle glaucoma in short is known as the POAG, and here it is nothing but it is also known as aka the chronic simple glaucoma of adult onset. So this has various characteristics. Firstly, there is increase in the IOP. Okay, so here in increased IOP, looking at further deeper, there is IOP greater than 21 mmHg on more than one occasion. So this is seen in greater than one occasion. And next, there is also a circadian variation, and this is in the IOP, it is greater than 8 mmHg. Next, there is also the asymmetry, and this is seen in the IOP greater than 5 mmHg, and here it is seen in case of both the eyes. Next, moving ahead, there is also the optic head changes. So in the optic head changes, it is suggestive of the glaucomatous damage, and this includes some changes, can include one or more of the following. So here the cup disc ratio, it is greater than 0.5, and looking at normal value, it is about 0.3. Then looking at the asymmetry, in the C is to D ratio is greater than 0.2, and here it is seen between both eyes. Next, what is included is the narrowing. There may be presence of the narrowing as well as notching and the pala, and this is of the neuroretinal rim. Next, there is also the disc hemorrhages. Then comes the visual field changes as well as the defect in the retinal layer. Defect in the retinal layer, retinal nerve fiber layer. So in case the POG diagnosis, there is about a 2 out of 3 criterias have to be fulfilled, and in case a patient is diagnosed of POAG along with a normal CD ratio and raised IOP, there can be a visual field defect, and this is mainly due to the damage of the retinal nerve fiber. Now, what are the risk factors which can contribute to this? You see the risk factors, it includes that there is higher the IOP, there is a greater chance of the glaucoma. Next is that in case of myopia, it is associated with an increased incidence of the POAG, and there is a 10% increase, there is a 10% increase risk of POAG, and here it is seen in case of the siblings, and 4% increase in case of risk in children and children of the patients of the POAG. Also, the patients with the POAG patients and their offspring and siblings, and they are most likely the steroid responders. That is, they respond to about 6 weeks topical steroid therapy, and this is with a significant rise in the IOP.